So what is buccal fat pad excision? Well, the buccal fat pad is a pocket of fat just beneath the cheekbones. I often get patients in the office who want more of an oval-shaped face or less chubby cheeks, and taking out that pocket of fat is one way of doing that. Another reason to have a buccal fat pad excision is if you want more shadowing. So if you're using contouring with your makeup too often or too much, then a buccal fat pad may give you that result. So what is it like to get a buccal fat pad excision? Well, I do this in the office. Of course, any procedure can be done under anesthesia, but I do it quite frequently in the office under local anesthesia. You don't feel anything after the numbing medicine goes in, so a lot of people describe it to feel much like a dental procedure, if you're getting a root canal or something. I make a tiny incision inside the mouth, and that gives me access to the buccal fat. It is one discrete pocket of fat, so it's not as if I can take part of it. I usually take the whole fat pad out. It takes about 30 to 45 minutes in the office, depending on whether you've had surgery in that area or not. And then afterwards, I use dissolving stitches inside the mouth that generally come out at about a week's time. So what are the risks and recovery like after buccal fat pad excision? The main things I look for in the procedure is not damaging any blood vessels in the area and not damaging any nerves. There are some vital structures that go through that area. One of those is the parotid duct. And so most of the dissection is blunt, and so I don't use sharp objects to cut things because it's a bit of a blind pouch. Needless to say, there is a small risk of getting a pocket of fluid in that area, which would need to be drained, and that can lead to more swelling afterwards. Everybody after buccal fat pad excision gets quite a bit of swelling. Anytime I do any procedures in the mouth, that's just the inherent recovery time is about a week of swelling. Most people feel like it looks like they've had their wisdom teeth out. And actually a lot of my patients even tell other people in public that they had their wisdom teeth out. It's a good way of kind of hiding that you had something done. I give my patients an ACE wrap to put some compression around the cheeks, and that gives some support, especially while you have quite a bit of swelling. You wear that for a week, and then another week just at night while you're at home after that.